we have about 6 minutes, I would say, that we can take some questions. I thought Dr. Hospitalis raised some interesting issues about challenging how we traditionally think about conflict of interest issues when it comes to dealing with this issue of NCDs. Do we follow the same strategy that we did in the context of tobacco, or is it that food calls for a slightly more nuanced approach, and that there may be actually opportunities there for us to engage in the private sector? Somebody, I can't remember what meeting it was I was at, but they talked about you sup with the devil, but with a long spoon. I think it was Alafia when she was giving her professorial lecture, and that image was just so vivid for me. So, you know, we eat with them, but you use a long spoon so you don't get too close and you don't get infected by any conflicts. So I open the floor. So as I said, it's 24 minutes past. So if we can quickly get some comments and questions. So I see Dr. Seeley over here, and there's a young lady in the back. So first in the back and then over to Dr. Seeley, please.
Good afternoon, Cedria and Martin from UNAIDS. Thank you for the presentations and really emphasizing the opportunity for intersectionality and partnership. I just want to emphasize that in terms of the UN Political Declaration on Ending AIDS signed in 2016, I think there's so many opportunities for collaboration. We have shared challenges in terms of limited fiscal space, some political apathy, some of the challenges around behavior change that we could work together to address, but also some shared opportunities in terms of priorities. We all want to work on health system strengthening, on lab support for diagnosis, for monitoring, also opportunities in terms of sustainable health financing. That's a major theme here, and certainly one for the HIV response in the Caribbean as well. And also we've been talking a lot about the social determinants of health. And so these are areas where we can really collaborate to get the job done. And then finally to mention the work of SCLAN around the global strategy that First Lady Granger mentioned this morning, and the fact that there are so many opportunities for advocacy around health and wellness that covers both NCDs and HIV. It's a welcome initiative that we support, and we look forward to partnerships with the people in this room to further all these agendas.
Okay, thank you, Dr. Seeley. And then Dr. Longsworth.
Questions, really. James, I'm aware that public-private partnership training is going on in government sectors, and in fact, included in the health sector, but it tends to be focused on the partnerships that are required for health services. So my question to you is, do you think it's a different type of training that is needed for knowing about public-private partnerships in terms of the things like the kinds of health promotion ideas that you have, as well as the health services delivery? Or should we be encouraging ministries of health for themselves, other sectors, and the civil society to take advantage of that kind of training when it takes place? And the second question is, you mentioned a particular foundation, a research company, foundation that is in fact associated with PepsiCo. So my question is, please, have you advised all countries about this? I think it would be important for CAFA to let Ministry of Health know, because we don't have that kind of data and intelligence as we go forward. And the third question is for my UN colleague. In one of the previous UN CARICOM meetings, the CARICOM countries asked for consideration of a Caribbean UN task force, interagency task force on NCDs. It was not picked up by the UN at that time, and I am putting out that, in fact, the UN may want to consider something like that so that we can benefit, because our needs are in fact particular to the region, and maybe to other regions as well. But we do tend to work on a regional basis. You have a regional framework, so I think it might be appropriate for us to consider.
Okay, in front here, Brent. And then I'll give the panelists a chance to respond. Oh, sorry. Yes.
Okay.
And then Brent.
Dr. Hospitalis, a question was posed this morning, I think it was by Dr. Tamu, about the use of traditional medicine in the management of diabetes, hypertension, and so on. I just wondered if there is any initiative in the Caribbean, even by CARPA, to address that particular question. And I ask because Central America is addressing that. I visited a center in Nicaragua where they're actually training their physicians and nurses alongside formal lectures and scientific initiatives with traditional medicines. In fact, they've taken it up to a different level, including lifestyle and exercise and all that. But that, I just wondered if you could respond to that.
Yes. No? Okay. I turn it over to the panel. Dr. Hospitalis.
Thank you. Well, in terms of the suggestion that was made for cooperation on NCDs and HIV, I've been asking for that for years. It's the same system platform: early diagnosis, lifelong treatment, behavior change counseling. And once you're on your medicines, your problem becomes NCDs, cholesterol, sugar, pressure, like everybody else. So I really welcome that idea. And we've borrowed from, on the NCD side, borrowed from the treatment cascade approach in the 1990 concept of HIV, and I think it applies to all the chronic diseases. You want 90% of people to know their condition, 90% to be on treatment, and 90% to be under control. And then you achieve 75% population level control. Karen, on the, if there are opportunities for public-private training within the government system, then by all means, folks from health should try to avail themselves of that. I don't know what the details are. There is a whole theory and practice around multi-sector partnerships. I don't think it's different, but it is specific around multi-sector, public-private, civil society. The one about Pepsi, I'll consider what you've just said, because another one academic institution in the Caribbean has indicated that they are partnered with them. The website and the press announcement said it's PAHO, CARPA, and this academic entity. And CARPA certainly was not partnered, and PAHO, I've asked, are you all aware of this? Did you see this in a newspaper? And I haven't had a final answer yet. On the traditional medicines, I don't have a good answer for that. I know it's widespread. I grew up with my grandmother taking Coralie instead of taking her sugar medicine because she heard that Coralie was good. And Cerasee and soursop leaves, and there's a long list. I don't know what the answer to this is in our region.
Yes, Mr. Pusa.
Thank you. Dr. Seeley, I had not heard of this pre-existing dialogue between CARICOM and the UN on the NCDs. Of course, I defer to the long experience of my PAHO WHO colleague, Dr. Gandhi, in the room. If you have any knowledge of that history, otherwise I can only commit to following it up.
Tamu, yeah.
They're doing a lot of research around the use of different herbs, and actually we're also setting up to produce pharmaceutical drugs related to many different herbs, mainly around prostate cancer. I know it's one of the prominent drugs. So Professor Henry Lowe is one of our lead persons in this area, and they're doing other bilateral partnerships to further this. With respect to the task force, maybe another possibility is to look at small island states, as well as CARICOM for this task force.
Okay, so thank you very much, ladies and gentlemen, for your patience and for your discipline in respecting our time limits, etc. Thanks once again to our panelists.